Okay, hi everyone. So we've got Becky, Sam, Kier and myself, joined by our training programme director, Mary, and we'd like to give you a bit of a snapshot about what it's like to train within intellectual disabilities psychiatry in the East Midlands. We're doing the video ourselves, so we're going to try and keep it to about 3 minutes, bloopers and all. So if we start off with Kier, we'd like to find out a bit more about what made you choose Psychiatry of Intellectual Disabilities.
For me, it was a natural choice. I think a lot of us have some inspiration of some kind for the specialty, be it kind of in our personal lives or maybe somebody we've met along the way in our training, somebody with an intellectual disability that kind of gives you that real inspiration to work in the field. Because I think perhaps in the past, this group haven't always had the same privileges that people without an intellectual disability have had. So it feels like such an honour to kind of advocate for this group and to work with this kind of really inspiring group of people, really. And the job itself is really rewarding and varied and endlessly interesting. And I think it can also offer a relatively good work-life balance compared to other specialties. So it's a choice that came very naturally to me and one I've never regretted. How about you, Becky? What do you think?
Yeah, I'd echo what you'd say, and it was definitely kind of the excitement of having kind of puzzles, and it feels like finding the clues. The complexity of intellectual disabilities psychiatry is what makes it interesting. You know, every day is different. And it's been really rewarding to, to get to know patients and carers, often developing kind of long-term relationships with people. And I think that's been kind of really special. And I think there was something about choosing, that there's a lot of equal kind of physical and mental health, and indeed social care play a key part in this field. So I think that's been something that's really appealed to me. Yeah, I wonder, Mariam, is there anything you wish you'd known before you started, or what surprised you about it?
Yeah, so for me, I think I was quite surprised by how much we work across the East Midlands. So we've got trainees in Nottingham and trainees in Leicester. And although I'm based in Nottingham, we do a lot of work with the Leicester trainees, and we see although relatively often, and kind of develop some sort of nice working and friendships there too. The other thing I guess might be about the special interest and research time. So we get this kind of protected time each week, and I guess I was surprised by how protected that was, and how sort of keen everyone is to make sure we make the most of that time. And yeah, I guess the range of areas in which you work in. So throughout my training, I worked in a really broad area of settings, so in acute inpatient setting, locked rehab setting, forensic inpatient work, our kind of equivalent crisis team, which we call ICAT, within sort of general community services, but we've also got a day centre as well that we kind of can work in. So it's quite varied, the work that you can do within the specialty. Sam, I don't know if you've got anything else to add.
Yes, I mean, I've really, I guess, of the things that have surprised me a lot is the extent of multidisciplinary working in our specialty. I think it's something that we pride ourselves on, and ensures that we're providing the best possible care to our patients, who I know Kira's already alluded to, are a group of people that in the past perhaps haven't received the best care, and we can try our very best to bridge that gap and ensure that people with learning disabilities and those that care for them receive a consistently high quality of care. The other thing that I think has surprised me a bit in higher training is the sheer breadth of opportunities available, in the sense that a lot of people working in our speciality enjoy doing either teaching or management or research alongside their clinical work. and there's also opportunities to do that during your training. So for instance, I've been fortunate enough to be able to do a PhD during my higher training, which is something that I very much enjoyed and I feel has helped improve me as a clinician as well. Mary, what do you think makes a good intellectual disability registrar as training program director in the East Midlands?
I suppose for me, the primary thing is you soon pick up whether trainees really have a heart for working with the group of people with intellectual disabilities, you know, whether they're really driven by that and want the best for that patient group. And to me, that's absolutely key. Being a good and a very flexible communicator is so important. We see people who have speech, people who don't, people who communicate by verbal means, facial expression, by signing, so you get really good. And I mean, you guys have all just been learning Makaton, which I think is fantastic, because that's a great skill both now and for other aspects of your life. And also, I think the third thing for me is about having that inquiring mind. I think Becky mentioned it before. It's a bit like being a detective. You have to piece together everything and come up with a solution for the person who's in front of you and those supporting them. And that is so rewarding. And that's something you guys, again, are all really good at. And I think you learn partly through your training, but I think you're probably naturally attuned to it as well. So I think for me, those are the key things I'm looking for. So I think it's been great that we've all had the chance to speak on this video today and give you some pointers. I hope you like the backgrounds. They're all local scenes that we've all chosen to give you an idea of where we live and work and that work-life balance. And we hope you will all consider wanting to learn a bit more about training in the East Midlands in Psychiatry of Intellectual Disability, and please get in touch if you'd like to know more.